I'm 38 years old. I was diagnosed with essential thrombocythemia 22 years ago. I was a junior in high school. I have triple negative ET, and we didn't even know about any of those markers back in the 90s. Essentially, I hadn't felt well for a long time. I was complaining to my mom about dizziness, headaches, feeling really tired. And ultimately, during lunch one day, I collapsed in my high school cafeteria. I had a syncopal episode, lost consciousness, woke up on the floor with all these people standing around me, and certainly that moment changed everything. I can't look at my mom. I've had great days where ET has not been an impact in any of my daily activities, and I've had very scary days, very difficult days. By the way, when all of this started and I was diagnosed, my platelet count was 1.3 million. My mom got a phone call from my family doctor. There's been some type of error in the lab. We've got to repeat this. This can't be right. And a repeat test did confirm that count. That led to a bone marrow biopsy, several other testing, and that's how I was diagnosed. My local hematologist didn't have much of a direction in terms of where to go. Where do I go with ET? Where do I go with a 16-year-old with ET? What do I do with that? And thank God for my mom, who is queen of research. She found really great experts that were close to where we lived in Connecticut at the time. I ended up at Yale. I ended up being seen at Mount Sinai, Dr. Harriet Gilbert. And we had a great collaboration between these experts. Between my symptom burden and this syncopal episode, the decision was made for me to start interferon. So my second visit to Yale, the nurse sat down with me and taught me on an orange how to give myself injections. And we made our way home. I felt real amped up, and by the time we got there, I said, Mom, I can't do this. There's no way. You have to do this. So she had to practice on the orange. Forgot about that. And so those are, some of those early challenges. She got very good at her injection technique. I stayed on interferon for my teens into my early 20s. Sometimes I was on a combination of interferon with anagrelide. Sometimes I was on nothing when I couldn't tolerate the side effects of the drugs. There's always this dance of symptom burden versus side effects from the medications. And I'll say interferon is, it's cramped my style along the way in terms of fatigue and feeling muscle aches, body aches. My hair has gotten really thin on it. But migraines cramp my style too, and feeling fatigue from the ET really can get in my way as well. Something really interesting happened in my 20s. We decided to take a drug holiday because I'd had too much. I can't do this anymore. I can't take interferon anymore. And we held it. And we kept me on this little mini dose of anagrelide. And my platelet count stabilized to this steady 200,000. And we kept waiting, and we kept waiting to see this increase that historically would reoccur. And I spent 10 years with this slow and steady platelet count of 200,000. And I thought I had, ET in my rearview mirror. It was great. I just kept going. And in this time, a lot of really great things happened. I became a nurse. I became a nurse practitioner. I met a guy, a really great guy. He's not here today. He's home watching our 2 children. I have a daughter who's 6, and I have a little boy that's 3. And that was one of my biggest fears. None of us knew. The experts didn't know how this was going to impact my fertility. Was ET going to impact it? Were the medications going to impact it? And I had this great smooth pregnancy with my daughter. I easily got pregnant with my son. And in my first trimester, I went from this slow, steady 200,000 platelet count to 600,000. And that's weird because usually you don't see an increase in your platelets when you're pregnant. So that got everybody's attention. Now I've got an OB, a perinatologist, or a high-risk pregnancy doctor. I hadn't seen a hematologist for years. Now I have a hematologist again. Ultrasounds every 2 weeks. My son was over 9 pounds when he was born. Everything worked out really just fine. And so sometimes we have these huge fears. You think everything can go wrong, and then nothing goes wrong. Everything works out just the way we hope it can. So now I'm home with a toddler and a baby. And I slowly went back down to 300,000, and I kind of parked there with my platelet count. And I said, okay, let's do this again. Let's get back to that 200s. Let's stay right here. And then in March of 2016, that's where I was at 300,000. And a month later, I keep getting these vision changes and migraines again. And I'm exhausted. And I walked around 9 days in a row with a migraine and these vision changes, and I said, wait a minute. I remember when this was happening before, my platelets, were over 1 million. So I'm on the phone call, and sure enough, 1.7 million was my platelet count. So I got restarted on anagrelide, which does work for me, except the dose that it works for me causes a lot of cardiac symptoms like palpitations, and that can be pretty uncomfortable. So I ended up seeking another expert. I have a really great local hematologist. And if you go through these, you can kind of weed people out pretty quickly as you go through your own experiences of when you know that you know more than what the local people know. So I'm quite lucky with my local hematologist. But I've been able to build a great team between my local doctor and then an expert at Weill Cornell. And I'm now on a drug called Pegasus, which is a form of interferon that, my college years would have been a lot better if I'd had Pegasus at the time. It's a lot easier to manage. On Pegasus, I was able to come off of the anagrelide. I have a platelet count that is 400,000. But this year has been a really frustrating year for me. This time 6 months ago, I was in the hospital with multiple bilateral pulmonary embolisms. And I went to work on a Monday. And ended up in ICU just several hours later. And what happened is I got short of breath. I was just standing, talking with my patients. God, I can't catch my breath. My chest hurts. Do I have a pulmonary illness? No, I couldn't. My platelet count is low. I'm stable. My pulse ox is fine. I was assessing myself and kept saying, well, I'll give it 30 more minutes. I'll give it 30 more minutes. And I let myself get into really a place of distress. I had a very elevated heart rate and pretty bad chest pain. So there's a certain vulnerability that I'm walking with now that I'll sort that out. So it's been a very humbling experience, to say the least. And even when we think that we're doing all of the right things, sometimes things are out of our control and they can still happen. Despite all that, there's a lot of good things that have come into my life with, this disorder. You learn how to live and what's important. You build a village, like what we have here, becomes really important. So I feel, very grateful feel grateful to be here. I feel grateful to have the support of my family and friends, and thank you very much.